You're out to dinner with friends, laughing and joking and having a great time. Little do you know that the person sitting right across from you is having trouble getting out of bed every morning, has a lack of appetite, and is experiencing feelings of hopelessness. According to the Anxiety and Depression Association of America, more than 15 million American adults face depression within a year. Depression is a term that gets thrown around loosely, but in reality, it needs more awareness. As a young adult, adolescent, teenager, or even parent, it is important to be aware of what your friends, kids, or possibly even yourself may be going through, so that you know where to look for help and are aware of the different treatments available. There are multiple different kinds of treatments to help depression. According to the Mayo Clinic, this often begins within your 20s or 30s, which is why this is an important topic to be discussing with a college class, but it can also happen at any age. According to the American Psychiatric Association, depression is a common and serious mental illness that negatively affects how you feel, the way you think, and how you act. Being sad is not the same thing as having depression. If someone dies, loses a job, or you're going through a breakup, the feelings that come along with this trauma may be similar to the feelings that you have when you are depressed. Some people feel these feelings of sadness and hopelessness for no reason. When these feelings last for more than 2 weeks, this is most likely depression. Whether it be yourself, someone who you care about, it's important to be informed about the various treatments for depression. Luckily, depression is one of the most treatable according to psychiatry.org, and a statistic as large as 80 to 90% of people respond well to treatment. There are many different types of treatment, with one being self-help. It's important to be healthy in all different types of ways. Eating healthy is very important because getting good nutrition can help both your physical and mental health. Sleep is also extremely important because the lack of it will affect your mood and depression symptoms will increase. Exercise can be as effective as medicine according to thehelpguide.org. It boosts serotonin, chemical which is responsible for your mood, and it releases endorphins into your body which trigger positive feelings. Exercise also causes the growth of new brain cells, which is extremely important. Surround yourself with people who you care about. Have a strong support system. Help yourself by joining groups, reading blogs, and speaking to family members and close friends who you can trust. All of these self-help skills are extremely beneficial, but there's more one can do to help enhance the treatment of depression. Medication can be extremely helpful with changing and adjusting the chemistry within your brain. SSRIs, selective serotonin reuptake inhibitors, are the most common type of medication used for depression. These drugs allow for more serotonin to be available in the brain. Although medication can be extremely helpful, it is important that this is not the only thing you rely on and that there are other types of treatment you seek. Therapy is also a great type of treatment. There are different types of therapy, one being cognitive behavioral therapy. This type of therapy focuses on the present moment and problem-solving skills. Professionals use this diagram: thought, behavior, and emotion. CBT is based on how our thoughts and feelings and then actions all work together. Another type of therapy, which is a procedure used for depression, is ECT, electroconclusive therapy. This is used when patients haven't responded to other types of therapy and is a more intense therapy used for more severe depression. A person is given electrical stimulation to their brain, and it helps the chemistry of the brain, which will lessen the symptoms of depression. Now that you know what depression really is, let's rethink the phrase, "I'm depressed." If you're going through something difficult, you now have a better idea of brief feelings of sadness versus the need to speak to someone professional and seek out treatment. There should be comfort and hope in the fact that there are so many different ways to help treat depression. So whether it is you, a friend, a family, or a significant other, it is critical to be aware of the different types of treatments to face this mental illness and get through it. Thank you.